By the time the Shah reached New York, the situation with the stones blocking his biliary tract was desperate. He was whisked out of Mexico at the urging of Dr. Keene, who admitted his patient to New York Hospital under the pseudonym David Newsom. Dr. Keene was actually just the intermediary, as most of the preparations and decisions were being handled by the then Chief of Surgery, Dr. Hibbard Williams. The Shah was told the operating surgeon for his procedure would be the renowned Dr. Frank Glenn, but the surgery was performed by his trainee, Dr. Björn Thorbjarnarson. We traveled to New Jersey to interview Dr. Thorbjarnarson. There was much blame put on him for leaving in some stones, requiring a second surgery, and more importantly, for not removing the spleen while he had the chance. We therefore expected a more guarded interview, but to our delight and to his credit, Dr. Thorbjarnarson proved very open and forthcoming with his story.
I'm Dr. Björn Thorbjarnarson. At the time of the Shah's stay in the USA in 1979, I was an attending surgeon at the New York Hospital in New York and a clinical professor of surgery at the Cornell University.
Doctor, could you please tell us how the Shah came to be under your care?
I was in my office. It was across the street from the New York Hospital. I got a call from Dr. Hibbard Williams, who was the professor of medicine, the charge of the Department of Medicine. He told me he had a patient with common duct stones and asked me whether I would consult on him and take care of the problems. I said okay to that, and I went over to the hospital and saw him. He told me the patient was the Shah of Iran, who had been admitted to the hospital the day before under an alias, and told me that some tests had been done, and I went with him and saw the CAT scan and a sonogram that showed the stones in the common duct and in the gallbladder. After that, we went up to the Shah's room on the 17th floor at the New York Hospital, where he had the 3 rooms for his entourage. We went in to visit the Shah. At the door, there were 2 guards in civilian clothes with weapons, were armed. Went into the room. The Shah was lying in his bed. Hibbard Williams introduced me. Shah sat up and shook my hand and said that he was glad to have me take care of him, since I was the doctor that other doctors came to for their own care. Where he got that information from, I have no idea.
Doctor, did you have any previous knowledge that you were going to have such a high-profile patient before he came to New York?
No. When I got the call from Hibbard Williams, I thought he was just talking about an ordinary New Yorker, one of those people I would see on a daily basis.
Do you know when the Shah actually came, when you saw the Shah, what date that was?
I would have the date in the, I believe it was October 23rd, but I have it in my notes in there.
How long after that did you actually perform the surgery?
Next day.
The next day. Were you the original intended physician who was supposed to do the surgery, or was there somebody else that had planned on doing the surgery?
As far as I've known, I was the only one that was
We had heard that there was a Dr. Glenn that
Dr. Glenn was my mentor, was my teacher, who was retired.
oh, was he retired at that
Yes,
time?
yes.
Okay. How did you find the Shah in spirits, in his mood when you met him?
He was obviously sick, with some weight loss. He was lying in bed. He had mild jaundice. He had a palpable spleen. He had a large hard lymph node in the left side of his neck. He was well spoken. He was courteous. He was easy to get along with. He never raised any objections to any of the recommendations given to him. He was curious about some things, like having to sign a permission for tests or operations or whatever he had to have done at the hospital. He said this would never happen in Iran.
So take us through the day of the operation. Tell us about that.
The day of operation was the next morning. The administration arranged to give me the early time. It was 8 o'clock, I believe it was. And I had arranged to have Dr. Tompkins, Marjorie Tompkins, for anesthesiology at the request of the hospital administration. I had another attending physician helping me, Dr. William Grave, and then my resident, Eugene Novak, who is still in practice in New York City. The operating room was guarded by armed men. I believe they are from the New York police, although I'm not quite sure about that. In the operating room was a patient and scrub nurses, anesthesiologists, and my assistants. The Shah's private physician, Dr. Pirini, I believe his name is Pirini, who was a pediatrician, apparently had taken care of his children, and then followed him to New York and now helped him understand what was going on.
What was your specific purpose for that surgery? What was your...
The purpose was to remove the gallbladder and remove the stones out of his common duct, to examine his abdomen for any evidence of lymphoma that he at least had been suspected of having, although it seemed to need some further proof that this was the case. He arrived to us from another country, I believe from Panama, and he was getting medications. He was getting methotrexate and was on prednisone as a steroid. We had him prepped, for the operation by giving him a steroid prep. Dr. Williams, Hibbert Williams, was also in the operating room, and I believe an armed guard also sitting in the operating, sitting out to the side. The operation went well. We used what they call a right subcostal incision. He had a badly inflamed gallbladder. In trying to identify the structures, you need to find what we call a cystic duct, where it connects to the common duct and the gallbladder. I couldn't find the cystic duct, so I had to isolate the common duct and open up the common duct, and from inside the common duct, finding the cystic duct, which then fell apart on its own. I removed the gallbladder. I looked into the bile duct, with a scope. There was a stone in the lower end of the duct. There were some other stones and debris in the duct. And high up in the left hepatic duct, I saw an isolated stone. I removed the stones from the lower end of the common duct without any problem at all. I removed all the other stones in the lower end of the common duct. I thought I had removed the stone in the left hepatic duct in fragments. It certainly did not come out intact. I looked again with a scope and found no remaining stones. I demonstrated free communication into the duodenum. I did an X-ray, a cholangiogram, after putting in a T-tube. The X-ray showed no retained stones. And after repeating this, and again, I believe, looking with a scope, couldn't find any other stones, and closed the abdomen after putting in drains and leading a T-tube out through a stab wound. Examination of the abdomen otherwise revealed an enlarged spleen, but no lymph nodes that could be felt or seen anywhere inside the abdomen. I also did a liver biopsy. I felt a little bit uneasy about the fact that the left hepatic stone had not come out as an identifiable stone, but both the scoping and the X-rays failed to show any remaining stones, so there was nothing else we could do, and closed the abdomen.
So you actually knew at that time there was a stone in there, or you found out later that there was a stone that remained in there?
No, we saw the stone then later on. Later on we found out that indeed there was a stone left behind. And but that we found out about 5 or 6 days later.
But at the time, the X-ray and the visual inspection
didn't show anything. See, the common duct and the biliary tree is something like the trees you see out there. Mm. The trunk is, you can easily see all the way up to the first branches. Then the branches go out to the left hepatic duct, the right hepatic duct, and then secondary branches from there, and then tertiary branches from there. The scoping does not allow you to look into the terminal branches of the tree. The cholangiogram shows you the tree, but one branch is superimposed on another, so it may be very difficult to see whether anything is there or not. Dr. Perini was, I think, well aware of it, that we kept looking for a stone that we couldn't find. The Shah kept asking me, after he had waken up from his operation, how sure I was that there were no stones left in the biliary tree. I told him that I did not think there was any, but we would have to rely on a cholangiogram in a few days, since the X-rays done in the operating room were never of the best quality. they are done through a portable machine and lack the fine definition that you do in the regular X-ray suites. He asked me, you know, if there are more stones left, want to know whether you need another operation. I said no. We have this size 16 T-tube in place, and we're able to remove the stones through the tube.
Doctor, you mentioned the Shah was asking you questions. How aware was he of what was going on, and did he only ask you about the stones? Did he ask you about anything else about his health, about the spleen? Was he aware of that?
He was aware of all of that, but he did not ask me anything about the spleen. He just asked about the. I think he may have asked how many stones there were. He probably didn't count them, so I didn't know that.
Were there many?
Yeah, several, yes.
Okay. Doctor, please talk about the spleen. When you inspected the spleen, tell us the condition that you saw it in.
The spleen was enlarged, you know, but there was nothing in the size of the spleen that could tell me why it was enlarged. The thoughts had been beforehand that it could be from malaria that he apparently had at some time. The thought was also whether it could be due to a lymphoma. Mm-hmm. He had been seen by some French doctors that had done a needle biopsy of the lymph node in his neck, and I believe they had told him that he had a lymphoma, and that's why he was getting the methotrexate and the prednisone. He seemed not quite ready to accept the diagnosis of lymphoma at that time, and as his investigation went on, lymphangiograms, CAT scans, etc., and no evidence of lymphoma elsewhere in the body were found. But at the end of the gallbladder operation, I had his left neck re-draped and prepped and removed that large lymph node that he had there. The diagnosis was given us the next day as a histiocytic lymphoma. So that eliminated any question about whether he had a lymphoma or not.
Did you have, before the surgery, was there any notice given to you that you should pay special attention to the spleen, or maybe that he needed a splenectomy? Dr. Coleman mentioned that he had kind of wrote notes about this and wrote letters about this and notifying.
Well, like I said, you know, I wrote a little blurb for the American Surgical Journal, you know, after Dr.
Morgenstern, Dr. Morgenstern.
Morgenstern,
yes.
After Dr. Morgenstern's article, and I said that, you know, as we were doing just starting the operation, Dr. Coleman, who was an oncologist that was bringing this, stuck his head into the operating room and said, why don't you remove the spleen at the same while you're doing it, you know?
Why wouldn't you remove the spleen at that time?
Well, the Shah didn't think he needed to sign a permission for any operation. But here in the States, we have to have a patient's permission to do any elective surgery. I did not have the Shah's permission to take out the spleen. I had never talked to him. We had never talked to him about the need for taking out the spleen. I was doing a semi-emergency operation on a very sick person an operation that conceivably associated with some risks, although not terribly much, to add an elective operation to that, something I couldn't do.
With the health condition of the Shah and the stones and the operation you were doing, would this have added unnecessary risk to the splenectomy? It would have...
Yes, it would. Yes, it would have. There's no question about that. On the other hand, if things had been explained to me beforehand, and I had the chance to discuss it with the Shah, whether he was willing to take that added risk, and why the spleen should be removed, and if there had been agreement on that, I would have accepted the risk and done it.
So when Dr. Coleman came in, opened the surgery room door and said, "Why don't you take out the spleen?" that was the first you had known about that?
That was the first time I heard about this splenectomy.
Do you know if Dr. Coleman had communicated with the Shah about his spleen?
I don't know.
You think if it was just a regular patient, just average citizen going through the procedure with you, the spleen would have been taken out?
No.
Didn't have anything to do with the high-profile patient, and it was a risky operation.
No. You don't. And doing an elective operation on the gallbladder or the common duct, you might remove the appendix just to avoid any attacks of appendicitis later on in life. But that's about as far as it would go, in sort of unnecessary operation.
Let's go after the surgery. You talked to the Shah afterwards, and he was very curious about how everything turned out. And you told him that we would know in a couple of days if there's any stones remaining. Once you did discover the stones, explain to us from that point.
Well, there was a great consternation. Everybody involved, and the question had been at one time whether any results, like the results of the lymph node biopsy or others, whether that should be communicated to the Shah by his wife. Apparently, his wife had expressed the opinion that she should be the one to tell him any things that mattered there. Of course, we didn't pay any attention to that, So Dr. Williams and we went up to the Shah, and I told him about the stone, which he already knew about since he had discovered that, during the X-ray examination. And by the way, he was as an aside, he was intrigued by the fact that here he was in the New York City in the US of A, and being operated on by an Icelandic surgeon. When he was having his X-rays done, he also found out that one of the X-ray doctors was a Syrian, and another was an Iraqi, or of Iraqi descent, So he was, and later on, he was amazed that the doctor to pull the stone out through the T-tube was a German. I told him, this is New York City. In New York City, about half the population are foreign-born.
Who was the doctor that pulled out the stones, the remaining stones?
Joachim Berhenny. He's a German, and he had really worked out this method. It was a fairly new method, only been done for a few years. And at that time he was in Germany, but then he moved to the States. And when the time came, I assumed or planned that the stone should be removed by our own radiologists at the New York hospital, which they were perfectly able to do. But somebody stepped in and said that we have to get the consultation of the best person in the world to do this. Now, I had no idea who the best person in the world was, but I decided I would talk to Dr. Perhen and see whether he would come and do it. I had trouble finding him. He was not in Germany anymore. I finally found him in Vancouver, in British Columbia. So I called him up and told him I had a patient, and he said, sure, he'll come and do it. So 6 weeks later, they came in and took out the stone.
Doctor, post-op, when you were talking to the Shah, explaining to him about his stones and how the operation went, did you mention either to him or anybody else about the spleen, the enlarged spleen, the condition of that, and that it needed further care?
I really never talked to him about the treatment of his lymphoma or anything like that. After all the tests done at the New York hospital, and finding no evidence of lymphoma except that this one lymph node in the neck that now was removed, I think the evidence of him having any generalized lymphoma was maybe doubtful. I think he left. I think the methotrexate was stopped. I think the steroids were stopped before he left, and I am not quite sure about it, but he may have been given some chlorambucil, which is a mild anti-malignancy medication. For all we knew, all I thought I knew, his lymphoma had been isolated to his neck, and on the basis of that, radiation therapy to the neck was recommended. The radiation, for some reason, decided to do the radiation over at Memorial Hospital. That's across the street from us. Apparently this caused some consternation at first. At first, the oncologist at Memorial said he cannot have radiation here unless we pass on whether he should have the radiation or not. Or we pass on whether this is the proper treatment for the lymphoma.
Was that Dr. Shu, Dr. Florence Shu?
Florence Shu, she was the radiologist. She came and see him, and she was quite ready to do the radiation. I met her up in his room when she came in to discuss this with him. But I believe it's professional jealousy has something to do with this. The oncologist at Memorial felt left out, that here was a patient coming to their hospital for treatment of a cancer that they had not been asked to consult on. This was resolved by some of the higher ups, director of Memorial and some of the financiers that were sponsoring the Shah and were on the board of Memorial and so on. I can't name any names because I'm not quite sure, through. So he went there and had the treatment over 6 week time. They refused to have him treated in the daytime. They were afraid of the risks, of having a high-profile person go through there. So he was moved through tunnels between the hospital that night.
So, doctor, I just want to ask this again. Based on the operation that you did, the investigation, the looking at it physically, and deciding that the lymphoma was localized in the neck, in your opinion, the spleen didn't need any more attention at that time?
This is difficult to be sure about this, but I believe that the consideration at that time was that the spleen was due to malaria.
Okay. You mentioned the decisions being made about his care. Who was making the decisions for his health care? Who was telling you what to do and giving you the go-ahead?
We made the decision. The decisions about treatment were not made by Dr. Keane. Dr. Keane was the intermediary for everything that needed to be done. But I was asked to see the patient, and I was the one to decide what should be done. And nobody questioned that.
Who in the family were you just consulting with the family? I mean, on Shaw's behalf, who were you reporting to and communicating with?
I met his wife. His wife was after when I first talked to him. She was a classic lady, good looking, very intelligent, very well spoken. She didn't take any part in the discussions about what to do or what not to do. Dr. Perini was the doctor there that followed very closely what was going on, but again, she had no really input in what we did and what we didn't do.
Who did?
Who decided? Well, I did. I decided for the surgery was concerned. Like Dr. Williams, Hibbert Williams, and Dr. Coleman were the ones that decided on the medical aspects of it.
Once you and Dr. Coleman decided what's the proper course of care, who did you communicate that to? To the Shah, to his family, to his doctors? Who were you communicating to get consent from him?
When I did this operation, the day after I first saw him, I had not talked to or seen Dr. Coleman or anyone beforehand. I removed the lymph nodes because of the suspicion of lymphoma there. And that was that. Now, the discussions what to do after the diagnosis was established, I had no part in that.
Who was paying for the Shah's medical care when he was under your care? Who was paying for that?
You have a picture of the check was sent to me, I imagine, for something like that. Although it's quite possible that nobody ever sent him any bill or anything like that. I believe the tacit understanding was that the hospital institution would be amply rewarded for providing good care.
Please talk a little bit further about that. We had heard there was rumors that there was a $50 million payment made by the Shah to the hospital. Now, could you please tell us about that?
Yes, the $50 million were given to the hospital soon after this happened. Everybody assumed this had come from the Shah. But I heard the dean's answer to a question at the meeting we had. They said, no, the $50 million did not come from the Shah. I am not sure whether he was double speaking or so on, but the check I had was not from the Shah.
The $50 million came anonymously, correct?
Yes, it was anonymous.
And we've heard from different doctors through different countries about bags of cash being coming to pay for these.
That I have no idea.
You didn't
know nothing about that.
Okay. But the payments weren't made by the Shah; they were made by other companies and individuals.
Yes.
Doctor, talk to us about the care of a high-profile patient like the Shah. What do you think were the problems that persisted throughout his care, going from one country to another?
I think you always have to be very careful about not treating celebrities anything different from you would treat, the man in the street. Once you start adapting your choice of treatments or your treatments to the status of the person you're dealing with, you're heading for big trouble.
I'm sure you've treated a lot of high-profile patients before and after that. How did the Shah compare to the other ones and the pressure that was on you at that time?
I think he is number one or number two. Number two was a world famous artist that came under my care. With some rather disastrous happenings. But the Shah's around the top.
Explain your own feelings when you were doing this surgery and when all this was happening. What was going through your mind? I mean, I'm sure you treat every patient the same, but you must have had some thinking going on in the back of your head with all the pressure on you, the whole world watching.
No, fortunately, this is like any other ordinary operation. Surgeons have a sort of a mindset, you know, that not to once you get to the operating room, other things don't matter very much.
Would you do anything differently in the operation?
No.
In hindsight, would you pay more attention to the spleen or recommend that he had the splenectomy while he stayed in New York?
There was no reason to do anything to the spleen.
At that time.
The reason that the splenectomy came up later on, and the only thing I know about that is that a month or two or whatever, you know, after he had left the New York hospital, Dr. Keene came to me and said that Shah was now in Mexico and he had developed thrombocytopenia, and that may be an absolute indication for splenectomy. He asked me whether I would go to Mexico and do his operation. I said if the hospital would supply me with a team, I would do that. I heard nothing more about it.
As you know, the Shah didn't have the splenectomy in Mexico.
That's right.
He didn't have it in Panama. He went to Egypt, and Dr. Dibeki performed a splenectomy. Now he's the heart surgeon.
That's right.
Do you think he was the ideal person to perform that procedure on him?
I don't want to put any criticism on Dibeki. He's dead now, you know.
I understand.
But my impression is he was picked because of his name. The Egyptians and the Mexicans and the Panamanians believe they would accept a big name.
In hindsight, we know that there were certain complications with the surgery. Do you think if you had performed that surgery, those complications would have arisen? I'm not comparing you with Dr.
No, every surgeon can have a complication. Okay. Something can go wrong. Almost anybody doing it. On the other hand, the pancreas is the thing you have to pay a good deal of attention to when you do a splenectomy. The tail of the pancreas, the end of the pancreas, is usually intimately stuck into what we call the hilum of the spleen. So if you do a splenectomy, like an emergency splenectomy that the people used to do in the war times to the city hospital, you bring up the spleen and then put a big clamp right across the hilum of the spleen to clamp off the artery and the vein. Now, if you do that, then you also put the clamp across the end of the pancreas. Now, whether that is what happened, I have no idea. My second-hand information is that the specimen from the Egypt operation ended up in the New York hospital, and that the tender tail of the pancreas was in the specimen. But I have no absolute proof of this. Now, if this happens, when you do the splenectomy, what you do, and I'm sure they did, that you oversaw that you close the end of the pancreas, and that should be all right.
Is it standard procedure to provide a splint for the drain when you do a splenectomy?
No.
If it was enlarged, would you put a drain in there?
No.
No. So we know that after the surgery, there was when they did a biopsy, they found 1.5 liters of pus in there. During that month and a half, if you saw the complications that the Shah was having post surgery, would you go back in?
He would drain it.
Yeah. Doctor, did you feel any pressure? Did anybody ever contact you after the surgery?
After the operation, the hospital was under a siege. There were hundreds of protesters surrounding the hospital. The police barricaded the streets leading to the hospital. My office was right across the street. To get there from the hospital, I had to walk through the throng that was surrounding us. Nobody ever bothered me, one way or another. It interested me at one time whether I should maybe have some precaution. I asked the local police how difficult it would be to get the permit to carry a pistol. I never got the answer to that, so I didn't get it. The only threat I know about is one of the nurses that were taking care of the hospital got some threats and quit and left going. During the time in the hospital, somebody placed a call it code red or code blue or whatever it is, to 17th floor in the room with the shower setting. The crash cart was on the way. This is 2 or 3 residents pushing a heavy cart up to resuscitate person. It was on the way when somebody discovered that it had been a hoax or whatever it was. Now, if they had not been stopped, if they had come in there rushing with the cart, and they don't pay any attention to anybody when they do this. Whether the policemen would have picked up their weapons and shot them, I don't know, but fortunately it didn't happen.
When the Shah left the hospital after the 6 weeks, what condition was he in, and what were the circumstances under him leaving?
He was well. Nobody was told when he was leaving. I didn't know he was leaving. I knew he would leave almost any day. After I had removed the last red rubber catheter from his incision, he was free to go. And I believe he left a day or two after that. I think again it was after hours he left. It was moved through tunnels to an adjacent building and into a car at the parking lot there.
We know now that there was tremendous political pressure on the American government, U.S. government, to have the Shah leave the country. Were you aware of any indications of this at the time?
Nobody told me anything about that, but I had lots of calls from journalists and papers from all over the world, I never talked to any of them except finally I answered the call from the New York Times the day after and told them what had happened. One of my old patients is a science editor of one of the TV channels there. And I talked to him at times, and I trusted him that he would not go any further with it. One time I told him that if the Shah had been an ordinary New Yorker, he would have left the hospital to wait for the removal of the stone, which is ordinarily do. They would just go home with the T-tube and then come back to have the. Unfortunately, he couldn't sit on this. The journalist couldn't sit on this and told the anchor. And that night in the TV news, I was quoted as saying there was no need for the hospital, for the Shah to be in a hospital. This happened a day or two or the same time as all sorts of threats were being made to the hostages in Iran that might happen to them if this Shah stayed in the United States. Yes. So I was left with it like that, and that may have been the touchiest, moment of, as far as I was concerned.
Doctor, talk about the tunnel that he was going through.
If you have been to the east side of New York City, around York Avenue and 49th Street, there are several institutions. There's the New York Hospital, the Cornell, there is the Rockefeller Institute, there is Memorial Sloan Kettering Institution. There are residences, apartment houses belonging to the hospital also there. Between these, the Memorial and New York Hospital and the resident buildings, there are underground tunnels that connect the institutions. The Shah needed to use the tunnel to Memorial Sloan Kettering for the X-ray therapy, and the X-ray and the tunnel to the, I forgot the street number, to the building across the street, farther north, where the parking garage was, is where he left from.
Doctor, in conclusion, I'd like to take you back to when you heard that the Shah had passed away in Egypt because of complications with his splenectomy. What went through your head?
I don't want to have this on the...
Okay, you want us to take it off?
Yeah.
Okay.
I do
Stop
not.
that one. We're done with the interview. I just want to ask you this question.
Yeah.
Let me take this off of there. There's no doubt the Shah could have received better care in New York. The stones should have been correctly removed without requiring a second operation. The splenectomy could have been successfully performed. And his cancer should have been correctly diagnosed and treated. Dr. Thorbjarnarson has been the sole name associated with the Shah's ordeal in the U.S. But looking back at the saga begs the question: who else was involved and responsible in the faulty decision-making process that led to such an unfortunate outcome for the King of Kings?